Welcome back to Project Mayhem. I'm Dr. Maynard. Today we're going to go over a few things with shoulders. We've been getting several questions here lately on shoulder issues, either injuries, overuse, things of that nature. Some of these we cover, we may go into more in depth, so if you're interested in seeing something like that, let us know in the comment section below. Two things you want to keep in mind with shoulder issues. One, are we utilizing the core to extremity issue? Are we activating the diaphragm? Are we activating the core? Otherwise, we're just overusing the shoulder, so we can get some injuries with that. Another thing you want to keep in mind is scapular positioning. You want to make sure we got that scapula in a back position. That can be the difference between a no rep or an injury. It also, when we have the scapular position, it's going to put that weight into the spine and not into the shoulder joint itself. Okay, we're going to demonstrate some things here in a minute on scapular positioning. All right, Rachel here is demonstrating what the forward scapula looks like. As you can see through here, when we look at it, there's no rep. So if she was competing right now, she'd get a no rep call for this. In order for her to get this rep, she's either got to drive her head way forward, which once again breaks spinal neutral, bring it back, or she's got to really torque out these shoulder blades. A lot of tension, that little uncomfortable, right? Okay, let's come on back. All right, so all we have to do on her, I just want you to bring just this shoulder blade back. Now she's got a rep, just with that. The weight's transferring into the spine, and see the difference between the one side versus the other. Now you can see in order for Rachel to get this rep, she's got to drive her head forward, breaking spinal neutral, cause a little bit of pain there, or bring the head back, or we got to really torque out this shoulder joint here. A lot of pain, really tight through here, right? A little discomfort, looking at labrum issues, part of the rotator cuff issues, things of that nature. Or I'm going to have Rachel just bring this shoulder blade back. That's all she did. Didn't change the head position. Now we have a rep. Everything's good. Does it feel like a lot of torque in here? And then all this weight is now shifting to the spine instead of into this glenohumeral joint. This is a little bit of a coaching cue you can use. Somebody's having an issue bringing it forward and they can't see what it feels like. We're going to have him just take one of the bands, go around the rig. She's going to take it just a few slight steps forward just to get into this positioning here, okay? Then we're going to take the PVC pipe, have her set up just like she's doing some overhead press. So set up like we're doing that. And go. Make sure we keep the head back. And you see through here, she's getting a good scapular position through here. She's got the rep made. Also, you want to check, make sure they're not driving the rib cage up and out like that, so it keeps the rib cage down. Just do about a few reps like that. Good. That's good. Okay. And that's a little coaching cue you can use to kind of help coach some of that scapular position if someone's having a little bit harder time with it.